Hello everyone, I'm Manakapian, third year biomedical engineering. Today I'm going to talk about defibrillator. Defibrillation is a process in which an electronic device sends an electric shock to the heart to stop an extremely rapid irregular heartbeat and restore the normal rhythm. Defibrillation is a common treatment for life-threatening cardiac dysarrhythmias, ventricular defibrillation, and pulseless ventricular tachycardia. Need for a defibrillator. Ventricular fibrillation is a serious cardiac emergency resulting from asynchronous contraction of heart muscles. Due to ventricular fibrillation, there is an irregular rapid heart rhythm. Ventricular fibrillation can be converted into more efficient rhythm by applying a high energy shock to the heart. The sudden surge across the heart causes all muscle fibers to contract simultaneously. Possibly the fibers may then respond normal physiological pacemaking pulses. The instrument for administering the shock is called a defibrillator. Defibrillation is performed to correct life-threatening fibrillation of heart, which could result in cardiac arrest. It should be performed immediately after identifying that the patient is experiencing a cardiac emergency, has no pulse, and is unresponsive. Principle of defibrillation. Energy storage capacitor is charged at a relatively slow rate from AC line. Energy stored capacitor is then delivered at a relatively rapid rate to chest of the patient. Simple arrangement involve the discharge of capacitor energy through the patient's own resistance. The discharge resistance, which the patient represents as purely ohmic resistance of 50 to 100 ohm, approximately for a typical electrode size of 80 cm square. This particular wave from figure is called Laurent waveform. The pulse width of this waveform is generally 10 ms. Strength duration curve. Minimum defibrillation energy occurs for pulse duration of 3 to 10 meter second for most pulse shape. Pulse amplitude in tens of amperes, few thousand volts. Operator selects energy delivered 50 to 360 joules depends on intrinsic characteristics of patient disease, duration of arrhythmia, patient's age, type of arrhythmia. Mechanism. Fibrillation causes the heart to stop pumping blood, leading to brain damage. Fibrillators deliver a brief electric shock to the heart, which enables the heart's natural pacemaker to reach and control and establish a normal heart rhythm. Power of defibrillation. Higher voltage are required for external defibrillation than for internal defibrillation. A corrective shock of 750 to 800 volts is applied within a tenth of a second. That is the same voltage as 500 to 533 number of AA batteries. Normal cardiac conduction. Explain the cardiac conduction pathways with the electrical impulse originating in the SA node, right atrium, which travels to AV node. Division of the right and left ventricles. Down along the right and left bundles branches to the Purkinje fibers. Intrinsic heart rates at the SA node are 80 bpm, the AV node is 60 bpm, and ventricular rate is 40 bpm. Cardiac arrest. Occlusion of the coronary artery leads to ischemia. Ischemia leads to infarct, which causes interruption of normal cardiac conduction. Infarct VF by VT. Defibrillator electrodes. Type of defibrillator electrodes. A. Spoon-shaped electron applied directly to the heart. B. Paddle type electrode applied against the chest wall. C. Pad type electrode applied directly on the chest wall. Classes of discharge waveform. There are two general classes of waveforms, a monophasic waveform and biphasic waveform. Monophasic waveform Energy delivered in one direction through the patient heart. Biphasic waveform is energy delivered in both directions through the patient heart. The biphasic waveform is preferred over monophasic waveform to defibrillator. Why? A monophasic type give a high energy shock up to 360 to 400 joules due to which increased cardiac injury and it burns the chest around the shock pad sites. A biphasic type give two sequential lower energy shock of 120 to 200 joules with each other shock moving in the opposite polarity between the pads. Defibrillator are two types, an internal defibrillator and an external defibrillator. Internal defibrillator, electrodes placed directly to the heart, example pacemaker. External defibrillator, electrode placed directly on the heart, example AED. External defibrillator. For each minute elapsing between onset of ventricular fibrillation and first defibrillation, survival decreases by 10%. Defibrillator should be portable, battery operated. Small size. Energy in defibrillators usually stored in large capacitor. Total energy stored in capacitor WC equal to 1 by 2 CV square. Automatic external defibrillator. AED is a portable electronic device that automatically diagnoses the ventricular fibrillation in a patient. Automatic refers to the ability to autonomously analyze the patient's condition. AED is a type of external defibrillation process. AEDs require self-adhesive electrodes instead of handheld paddles. Working of AED. Turned on or opened AED. AED will instruct the user to connect the electrodes to the patient. Avoid touching the patient to avoid false readings by the unit. The AED examines the electrical output from the heart and determine the patient is in a shock-able rhythm or not. When device determines that shock is warranted, it will charge its internal capacitor in preparation to deliver the shock. When charged, the device instructs the user to ensure number 1 is touching the victim and then to press a red button to deliver the shock. Many AED units have an event memory which stores the ECG of patient along with details of the time the unit was activated and the number and strength of any shock delivered. Precautions. The paddles used in procedure should not be placed on a woman's breast or an internal pacemaker patient's. Before the paddles is used, a gel must be applied to the patient's skin. Risk in defibrillation. Skin burns from the defibrillator paddles are the most common complication of defibrillation. Other risks include injury to the heart muscle, abnormal heart rhythms, and blood clots. Troubleshooting. Attach an external and internal paddles if the monitor reads no paddles. Check to ensure that the leads are securely attached if the monitor reads no leads. Connect the unit to AC power if the message reads low battery. Verify that energy select control settings are correct if the defibrillator does not charge. Change the electrodes and make sure that the electrode adapter cable is properly connected if you receive a message of pacer failure. Restart the pacemaker. Close the recorder door and the paper roll if the monitor message reads check recorder. Thank you.